Hello, everyone. This is Nancy Muller. I'm with the Reproductive Health Supplies Coalition. And I am delighted to welcome you to the third in our series of webinars that's being jointly co-sponsored by Reproductive Health Supplies Coalition, the Menstrual Health Alliance India, WASH United, and the African Coalition for Menstrual Hygiene Management. We are so pleased to have you here. We've been part of discussions already on disposable sanitary pads and on reusable cloth sanitary pads. And this now is on standards and benchmarks for menstrual cups. So we have a great panel that we're really thrilled to have here. And they will introduce themselves, but I'm just going to run through the names quickly first, and then each of them can introduce themselves. Dr. Penelope Phillips-Howard from Liverpool School of Tropical Medicine, Shamira Nakalema from Womena, Alethea Osborne from Mannion Daniels and the Menstrual Cup Coalition, Lisa Hertz from Women's Global Health Innovations and the Be Free Cup, and Saloy Mogatle from UNFPA. I'd like Penny, if you would first introduce yourself, and then after this, I will review what we're going to cover in this webinar this evening.
Hello everyone, my name is Penny Phillips-Howard from the Liverpool School of Tropical Medicine. It's a delight to be with you all. Our group, linked with the Kenya Medical Research Institute and other partners, have been working on menstrual cups and menstrual products in research studies, predominantly in Kenya, and desktop studies. And we are delighted to be able to share some of that information with you today. Thank you.
Shamira, can you introduce yourself?
Yes, hello everyone. My name is Nakalema Shamira, and I work with Womena Uganda. I've been working with Womena for the last 5 years, and we are specifically doing implementation of menstrual health and menstrual cup interventions here in Uganda. And I'm so happy to be here. Thank you.
Thanks, Shamira. Alethea, are you there?
Hi, my name's Alethea Osborne. I'm a gender and social development expert working with Mannion Daniels. I've been working in menstrual health for over 6, 7 years and using a cup for at least as long. I'm here to give a brief overview later on of the Menstrual Cup Coalition and their role within this broader conversation. Great to be here. Thank you.
Thanks, Alethea. Lisa.
Hi, everyone. It's Lisa Hertz from Women's Global Health Innovations. We are the developer of a Be Free Cup, a menstrual cup, one of the menstrual cup manufacturers. And we are delighted to be here today to speak with wonderful other panelists and to speak on this really important product standards. And we also work in low and middle income countries in regard to education and delivering these products where we can affordably. Thank you.
Saloy.
Good morning, good afternoon, good evening, colleagues. My name is Saloy Mogatle, and I'm based in UNFPA Procurement Services Branch. I'm one of the members of the team that is responsible for assuring quality of all the RH medical devices, medicines, and any other products that are procured to support reproductive health across for UNFPA and other partners. I've been working with colleagues at UNICEF and with my other colleague, Mina, who has recently left UNFPA to work on the specifications for menstrual cups. And this is why we've been invited to this webinar. And we hope to learn more during this session. Thank you.
Thank you, Saloy. And again, I'm Nancy Muller. I'm with the Reproductive Health Supplies Coalition Menstrual Health Workstream as the co-chair, along with Tanya Mahajan, and who is on this call. And the Menstrual Health Workstream is part of the new and underutilized Reproductive Health Technologies Caucus in RHSC. And I'm also a global health consultant recently with having led the PATH menstrual health work for the last 12 years. Next slide, please. So on this webinar, which we have been eagerly awaiting, it's something that I think many of us globally have been thinking about and wanting to have some sort of standards or benchmarks technically and safety-wise to identify what are the key issues that a menstrual cup should measure up to be an acceptable high quality menstrual cup that can be useful for women and menstruators around the world. And the topics that will be covered in this webinar today are the status of benchmarks that are existing, and then looking at some of the key considerations, which will be in the form of a panel discussion primarily with these esteemed panelists that represent very different parts of the menstrual cup picture from the perspective of country evidence generation and research that's being done from the perspective of a manufacturer, from a global entity such as UNFPA, and from a coalition that represents menstrual cup companies and groups that are working to advance menstrual cups. So they will all be looking at some of the key considerations for global benchmarks, including things like safety, the evidence in low and middle income country settings, testing, classification of cups, what are the regulatory and importation requirements at the country level, and the labeling issues. So we'll be going through this as a series of questions, and then at the end, look at what are next steps. Next slide, please. So just briefly, the panelists will touch on this, but I wanted to just mention that in terms of the big picture, that there really is a dearth of standards globally on menstrual cups. I think many people think that the US FDA, Food and Drug Administration, has a standard and has a series of tests that cups have to pass and that people pass, you know, that they meet the FDA standards. But in fact, the FDA classifies menstrual cups as a Class 2 medical device, which means they don't require approval in the same way as a Class 3 device would require. That they regulate only end products, so not even the materials. So when people say that the silicone is FDA approved, that's not technically correct, from my understanding. And then cups can clear for sale in the US through pre-market notification. So it's more that process. And that's, I think, if there are differences from existing cups that have been already approved. In the European Union, it's considered a personal hygiene product. And there's just a general series of product safety directives there. It's voluntary to get a CE mark or some sort of confirmation that a cup meets the EU regulations. So globally, there are ISO regulations that will be discussed a bit more. And in Australia, there are some standards, but it's considered a therapeutic good. Next slide, please. So what are the benchmarks and criteria that are most important? That's what we're really going to look at today. Manufacturers and organizations working on menstrual cups and advocacy groups have been trying to look and develop menstrual cups, especially to guide use in low and middle income countries where, you know, the conditions of use may be quite different in terms of access to water and hygiene facilities. And just basic access to cups, which I think generally are available online and not very commonly available through any sort of brick and mortar outlet, often through NGOs who will donate cups. So what are the criteria that are most important, and what kind of evidence is needed to ensure that a menstrual cup is appropriate in a condition of use in the low and middle income country settings? We're going to be looking at that through each of the panelists and some key questions we'll pose to them. So the questions, we can move to that slide. We have a series of questions, and we'll then get into the panel discussion where we will address these with one panelist speaking to it and others jumping in. So the first one is, why is it important to have a set of benchmarks for menstrual cups, especially when considering use in low and middle income countries? Why does this even matter? If there are not, firm standards that a cup has to pass in other countries, why is this important? And then what are we learning from the research that's being done currently in low and middle income countries about the factors that are most important to consider in developing these benchmarks? Next slide, please. The third question we have is, what does the ISO testing address, and what are the most important tests that really should be included in looking at standards or benchmarks technically for a menstrual cup that would be listed and for procurement into global settings? We want to be sure that safety and quality is ensured. And what are these key benchmarks that should be included for design and materials? Are there particular things we need to think about the materials that are used or a cup's design? Next slide, please. And then the last three are, what kind of information needs to be included in the packaging and labeling for cups? How does a consumer know how to use a cup, or what the cup is made of, or any of these factors about, like, has it passed some sort of tests? So what should be on the packaging and labeling? What is the most important classification for a cup? So it's different, as you heard, from different countries. It's a medical device in some countries, and a consumer product or a therapeutic good in others, with fairly low bar for requiring to be passed on anything. And then what are the import regulations or other kinds of regulatory issues that countries might apply to menstrual cups that should be considered? So these are the key questions we're going to be looking at now through our panelists, who all have a unique and deep perspective on this. So I think we'll first turn to you, Penny, and ask about the work that you've been doing, and you can perhaps present the slides that you have, and then address the question of why it's important to have a set of benchmarks for menstrual cups, especially when considering use in these low and middle income countries, and what are the learnings from the research that's being done that are really important in addressing menstrual cups. Over to you, Penny.
Thank you so much, Nancy. So why is it important? I think some of our studies, we've done a very large systematic review. And in that review, you can see that cups are increasingly used in some 99 countries, with around 199 brands manufactured across the globe. Now, use of products or medical devices in high-income countries are subject, or more subject, to monitoring for adverse events, severe adverse events. In low-income countries, really there's no monitoring in situ, except perhaps in research or in an NGO program where there is some follow-up of individuals. It's often not possible to follow up at all. It's not clear if information, say as in the packaging information as part of purchase, which instructs on safe, effective use, actually reaches the end user, or does the end user adequately get trained on how to use the cup? You know, in some of these small dukas in the middle of rural areas, are they able to train on use and safety? So it's really important that benchmarks on safety effectiveness are available to protect users. It is worth mentioning that wash and conditions may be poorer in low-income countries, but I think we recognise also areas of high-income countries are also impoverished. with inadequate resources and facilities. But there is a concern that if there's one particular brand which is either cheap or very poor quality, if severe adverse events were to occur and be blamed, they would be blamed on the cup, not specifically on that particular brand. And so it's in the best interests anyway of everyone to have the highest possible standards. Then the second one related to what are we learning? There's plenty more of research to do. Of course, there's always research that can be done. So far amongst academics, NGOs and programs, we are building the evidence, and we can give some examples of the type of information currently available. Probably the least available information at the moment are plausible denominators, which are highly relevant for calculating rates. For example, is toxic shock syndrome, if, is it 3 to 6 per 100,000, which is, what it was for highly absorbent tampons in the 1980s. If there are 5 TSS in cup users, there are 500,000 users, 1 million users, 50 users. So we really need more information on actual use so that we can both judge safety risks and compare against what else is out there. So both cost effectiveness and safety analyses. So I'll whiz through a couple of slides. This first one is from a global systematic review by a group of researchers. LMIC Van Eyck is the lead researcher in this. This one is just looking at studies published up till the beginning of last year and looking at use and acceptance. So if a study was published and it provided that information, we captured that information. Here, what you will see is of these studies that were published, people, women and girls, trans that had used the cups, they were asked if they would continue, if they were acceptable and they would like to continue using the cups. And the line in the middle going down, that reflects the midway point, which is 75%, just around 75%. So in all of people using the cup, once they have used it, there's a high acceptance rate and wish to continue using the cups. So in this particular study, there are about 43 research studies that we could gather the information from and look at acceptance, safety, and the effectiveness in girls and women around the globe. Next slide, please. Thank you. This, just very briefly, this is just to remind us all that the brown-orange line reflects observation on changing colour of a cup, whereas the one at the top in blue is girls reporting, self-reporting they actually used. And from that particular site, you can just see quite clearly that self-reported use is a lot higher than observations, physical change in the cup. So of course, how you gather your data is relevant in understanding use of a product. Next one, please. Thank you. So in this global review that was conducted, the information at the bottom, you can access the article through the Lancet. So key considerations, we were interested in leakage. We used leakage as the example of efficacy of use. And not many studies actually have published information from studies on leakage. So there are 1, 2, 3, 4, 5, about 7 studies here at the top here. And again, what you will see is a little graph. And what it shows is the majority of studies show a very small proportion of users saying that they leaked when they used the cup. One study a little more in North, and I think that's in soft cups. But what you will see on the right-hand side in the follow-up column is that that was over a very short time. over the first 3 cycles mostly, with one slightly longer, but well, longer over 12 months. And what you see is that, of course, in the first few months, people are getting used to using the cup. The one at the bottom is of 4 studies, and that was able to make a comparison between cup use and leakage and another product use and leakage. And what those basically show is that there's very little difference in terms of leakage between cup use or the use of another menstrual product. Using a cup doesn't cause more leakage than any other product. Next slide, please. Okay, so again, I'd refer you to the full article, which has a huge amount of detail. So this is a really quick summary, and we're interested in adverse events and severe adverse events. Obviously, right at the top is toxic shock syndrome, and utilizing the data from the FDA and other databases at that time, we were able to identify 5 toxic shock syndrome. Amongst those, a couple were with soft cup, and the other 3 were with the vaginal cups, so the harder cups. If you can put it back, that would be helpful. Thank you. Then there were other adverse events. Are you able to put it back to that slide, please? Oh, okay. Okay. I might have it up. Right, so there are other adverse events, allergies and rashes. There are about 6 reported. Irritation related to vaginal or cervical irritation. No abnormalities of the cervix or vagina. Pain and wounds, there were 5 case reports. Urinary tract infections, or a few in the hydronephrosis in a couple of cases, 3 cases. Dislodgement of IUDs, there were 13, 5 reported in one cohort study and 8 in other case reports. And that's related to having the cup in, and when the cup is pulled out from the tail, there's dislodgement of the IUD. Some cases, 49 at that time, had been reported related to a retained cup. Retained cup being that help was required to remove the cup, and the individual wasn't able to remove it on their own. Majority of those were soft cups, or cervical as we call them, against the harder vaginal cups. And vaginal flora, in a group of studies with over 500 girls and women, 4 studies, no disruption was found in the microflora. So the microbiome didn't seem to be disrupted or affected by the use of a menstrual cup. Next one, please. Okay. Yes. Yeah. Just very briefly. This is, I think, the size is a bit wrong here. This was a very small study, a pilot study in Kenya, where there was a comparison between 3 groups, and of course, it was only about 600-700 girls, so therefore you wouldn't expect to find toxic shock syndrome in any of them as a rare event. We did Staphylococcus aureus studies, so true in vivo, not in vitro, in vivo studies, where the colonization of Staph aureus within the vagina was proportionately equal across all the different groups. And it's a bit of a mishmash here, as you'll see the slide is a bit distorted. But what we found was we followed up on cup users and took swatches and swabs of the cups to look at E. coli on the cup. And what we found was that as the girls got used to the cups, there was less and less E. coli. In other words, it was more related to new users, not very adept at using the cup and letting it fall on the ground. So contamination during early use of new users, as opposed to development of a problem over time. with increased growth of bacteria. Right, then the last slide, please. I think I've gone over time. So if anyone is interested, we can discuss. We did do a small study on costs related to cup use compared with sanitary pads, but I'll hand it over to my colleagues. Thank you.
Penny, thanks so much. That is exciting to hear all of this research, which I know your team and you have been doing for a number of years in Kenya on menstrual cups and looking at various angles. And I guess the thing that kind of jumps out to me is the issues that have come up, which were, it seemed like not very many when you looked at the number of studies that you were covering in terms of the safety, and that it was really seemed like about user understanding of the cup, and less about necessarily the cup in terms of retained use being the highest challenge, and then the dislodged IUD, which would both be issues primarily around how you would use a cup effectively and remove it. So that's really interesting to hear the findings. I also wanted to just say to everybody on this call, I think we have over 100 people who are logged on, which is great. You are all no doubt, engaged in ways in this area and have questions. So please use the chat box to put in your questions and also introduce yourself so we know who's on the call. We know that there's a rich community here working in this area, and we're excited to have everybody on. So please engage with us and put in some questions, and we'll try to save some time at the end for questions that don't come up through the various panelists. Great. If any other panelists want to add anything to what Penny has said, please feel free for a couple of minutes. Otherwise, we'll move on to Shamira. All right, then. Shamira, would you like to tell us about, we'd really want to find out from you, what are the key messages to communicate to users to ensure safety, as we talked about in this last presentation, some of the things that come up, when cups should be used and when they shouldn't be used, cleaning and storage issues. And can you give us an idea of what Womena has been involved with and what you see from the field perspective, country's perspective in Uganda, have been issues related to the actual use of cups to ensure safety?
Okay, Nancy. Thank you so much, everyone, for participating again. And I'm going to take you through our experience in Uganda and what we've done to ensure menstrual cups are being standardized here. So as an organization, we are actually deeply committed to safeguarding and safety. And the fact that the menstrual cup is one inside the vagina, we believe that classifications and standards are a major way to contribute to the safety of the menstrual cup. Just to note that the African Union is increasingly focusing on this, and standards are as good as compliance and enforcement. So we in Uganda, we want to ensure that the end user gets the product that they are satisfied with. So we've seen a lot of products on market, and we assume that they are very cheap according to the market of the product worldwide, and we think that they are not standardized. We have engaged with national authorities here in Uganda, and these include the National Drug Authority and the Uganda Bureau of Standards. And since our establishment here in Uganda, that is in 2012, we have ensured that we are in these existing regulations. So we want to assist in the development of classification and standards. And we see that the NDA in 18 recommended MCs to not be classified as medical device and rather to be classified as consumer products. And we see that this was forwarded to UNBS to regulate and develop the standards. So as an organization, Women Uganda, we have done a number of discussions with Uganda National Bureau of Standards, and we've tried to address some of their concerns. We've also done this through the questions and answer information that we provide on our platform and website, and we see that some of their concerns have been addressed. As an organization, still we've used our advocacy strategy to engage international partners. These include UN agencies like UNFPA, and on a number of occasions, we have absolutely forwarded our concerns about this standardization of the menstrual cups and ensuring that UNFPA comes on board. So we are delighted to have like UNFPA here, and we are also happy that actually they have tried to develop standards for menstrual cups. This is really, really essential for further development, but also as advocates of improved menstrual health management and hygiene. We have tried so hard here in Uganda to ensure that the end user of a cup received the proper product. We've also succeeded on the removal of the tax of menstrual cup products, menstrual health products here in Uganda, and these include the menstrual cup. So when we go to the next slide, as you've asked Nancy, we need to present to whoever is going to use this product proper information and the guidelines on how to use the product. But how do we do this? We find that as implementers, we reach the end user, and these are the beneficiaries from our side. And as practitioners, we find that there's a lot of concerns related to RTIs, IUD usage, and uterine prolapse, and other safety concerns. So we've seen that when it comes to uterine prolapse, we've seen concerns not only at national level, but at global level, where we've seen like on media, like for example, on BBC, some women came up to raise concerns about the incorrect instructions of MC brands that might cause the girls and women to incorrectly use the menstrual cup, hence leading to uterine prolapse. As Penelope said earlier, 43 studies have confirmed that the menstrual cups are safe, and our medical team still confirms this. We see that the vagina is elastic and it stretches, and we think that the removal and insertion of the menstrual cup cannot cause this prolapse. So as an organization, we recommend that the manufacturers of these products consider proper labeling of the product with correct advice, use and care guidelines of the cup. This labeling should have instructions on clear removal and insertion procedures, maybe with pictorials, considering person with disabilities. It should be in simple language. If it is English, it should be very, very simple. And if possible, it should be translated depending on the context we are giving this cup or we are presenting this cup. So for us as women, we've implemented in Uganda and in different parts and different cultures. So we do several translations as we deliver this information to the end user, because our aim is to ensure that they get the proper use and care guidelines. When it comes to the product track infection, we see that a number of women and girls at a certain point have developed like yeast or vaginosis, and 20 to 30% or even more in low-income countries have experienced this. So we find that infections sometimes don't show symptoms, which means that someone might have the infection without noticing that actually they have it. So menstruation is a normal process, and menstrual blood should not like cause infection. But however, the product we use that absorbs or collects menstrual flow might potentially cause the risk of infections. So we've seen that studies have evaluated this, and they have showed that some washable products are likely to cause infection. This will depend on the type of the product, the content as a washable product, the hour of drying, the storage, which may export to infection. So for the manufacturer out there, and when it comes to labeling, it is very, very important to distinguish between the typical use and care guidelines. And the studies we've seen, as Penelope indicated earlier, we found that some studies have indicated that menstrual cups are not associated with infections. And we see that it is the opposite of the reusable part. So the instruction of the use and care when a manufacturer is promoting their product, they should be very, very clear. When it comes to the IUD is the most used contraceptive worldwide, and this might not be the case here in Uganda, because here in Uganda, according to UN, it is at 0.9%. But still, we get concerns about it coming out when someone is using a cup. And we have to endeavor to give explanations on how and why it might come out. The first that we present is the insertion period, that is maybe during or maybe after, immediately after birth. If someone inserts the IUD immediately after birth, and also heavy bleeding periods that might cause the IUD to come out. But also when it comes to using the menstrual cup, it depends on how you use it. The manufacturer should also indicate this, the right position of inserting the menstrual cup. Should the person using this product ensure that the cup is inserted properly? And should they also ensure that the seal, when it is inserted into the vagina, the seal is released before the removal, so that when they remove the cup, the IUD does not follow. So we see that several manufacturers have recommended this, that we should ensure that the cup is inserted properly, but also release the seal. However, there is need to take care on this, as whoever is using a cup, that is the end user, is given proper information on how to remove the cup. And this should also be included in the labeling or the information sheet that comes with the cup that is going to be distributed to the end user. Cleaning and storage. When it comes to cleaning, from our side, we are in a low context, and we want to ensure with whoever is receiving the cup does hand washing before removal and insertion. It is very, very important. We give them steps on how to do this. And we would recommend that, if possible, the manufacturer does this with simple English, but also considering person with disabilities. We provide special materials for disinfection. For example, we give a metallic container and emphasize that this should be used during disinfecting the cup. Though we recommend that manufacturers, most of the cups that are on brand, on market right now, they don't have like what we call like a metallic container or a container to store in. So it would be good, for example, in the context that we are in, to provide the end user with a container that they can use to boil the cup, because it is really, really relevant to avoid like the infection. But also when a manufacturer is labeling their products, they should ensure that they recommend that whoever is using the cup, the end user, does not use the soap when they are cleaning the cup. Because, for example, here in our context, proper cleaning is not so good. So you might find that someone might use soap and they don't properly clean it, and they insert it in the vagina, and it affects the good bacteria there. And we see that the disinfecting container, as I recommended earlier, it can also be used for storage. Here in our context, we have rats. The cups are not properly stored. So you find that they might be bitten by the rat, and because it is one of the most sustainable menstrual management methods, we want the end user to use it for the recommended period. So it is very, very important to also include that the container that is provided can also be used for storage. As cleaning itself, we not found academic evidence, but we have anecdotal evidence that people can practice these methods if they are correctly provided to them. The MC cleaning instruction should be there to support the user in preventing hygienic infections that originate in the lack of hand washing and using soap. So it is very, very important to the manufacturer to consider the safety of the end user, which is very primarily here, the safety of the product. And this will depend on the context where they want to distribute the product. It should have safety guidelines, and this should be adhered by the manufacturers. So whoever is producing a cup and they want to label, they should ensure that at least they consider the end user. They don't have to get infections. As an organization, we provide comprehensive training on how to safely use this product. So we think that this would be really, really relevant if the manufacturers contribute to this. This way we shall promote safe use and care of the menstrual cups. Here in Uganda, we have concerns about hymen and virginity, mostly in central, that is the Uganda region. And to me, or to us as an organization, it is okay to be concerned about something that is going to be inserted into the vagina. And as a mother, your girl is still young, and as a girl, you're still young, so you need to know what is exactly going to be inserted into the vagina. But here in Uganda still, and culture, a girl is supposed to be a virgin before marriage. And to prove this, on a wedding day, the sheet has to be with blood. So if some of the cultures say that the hymen should cover the opening of the vagina, how will blood come out when we reach puberty and we have to menstruate? So we usually pose these questions to the girls and ask them, and how do you measure like virginity? How do you tell that someone is a virgin or not? We also present this to whoever we are giving the product. So we also explain to them that if the hymen covers the opening of the vagina, that means that menstrual flow will not come out. So you need like a simple surgery. There is an imperforated hymen there. So we ensure that we tell them that there is no membrane that covers the opening. And if they want to keep their hymens as intact as possible, maybe the menstrual cup is not the choice as a menstrual product. But before we do this, as we are delivering menstrual health information, we present to them the different menstrual management methods around the globe. With this, we aim at providing choice because we are not imposing the menstrual cup to them, as we have other menstrual management methods on the globe. We ensure that we explain to them.
Are you,
Okay.
we're going to need to move on to cover the other speakers. Can you just make one more point perhaps?
Okay, so the last one would be like the disposal guidelines. It is really, really important for whoever is manufacturing the product, the menstrual cup, to indicate how the cup can be disposed of. Some of the users of the menstrual cups here in Uganda have not reached 10 years, but they have these concerns. We know that it is medical grade silicone. We can dispose it off in the garbage, but to show the end user that it is evidence-based, maybe we need to include it on our labeling. Yeah, thank you so much.
Thank you, Shamir. That was great. So much information from the perspective of a particular country and experiences of using menstrual cups, but also of working with the Bureau of Standards. And we're getting a lot of questions. I just want to make sure we have time. Several of them are for you. So we're going to wait till the end to ask the questions. And thank you so much for all that great information, which I think a lot of it points to the lack of familiarity with cups, the fact that they're not widely available, and so they're still very much a new product, and there's just not enough information about them. Maybe to that point, Alethea, we're glad you could join us and tell us a bit about the Menstrual Cup Coalition and the role that plays in things like global standards, having coalitions like yours.
Hello, this is Janie Hampton. Alethea has lost her connection.
Oh, okay. Hi, Janie. I'm so glad you're there. Would you be able to speak to this? I know that Alethea has one slide here.
Okay, can you show me her slide?
I'm here.
Yes.
Oh, you're here. It's okay. Alethea can take over.
Great.
Sorry, thank you, Janie. I apologize, my internet. Yeah.
No problem.
Just as a very quick overview, just to kind of do an introduction to the Menstrual Cup Coalition, just to say, so we have over 40 member organizations from all across the world, and those members range including organizations who are working in country to do cup interventions, practitioners, entrepreneurs, researchers, and the main thing is they're all very committed to the promotion of informed choice around cups and sharing information between people who are working on menstrual cup projects and advising one another on activities or working together to identify research priorities and collaborate on joint research projects. One of the big things really for us is we're trying to be sort of go-to place to try and cut through a lot of the jargon and the barriers to people who are wanting to start using menstrual cups in projects that they're involved in, particularly in the global south, because I think it's often quite overwhelming, and we can see just from the conversation today that there are so many details and aspects to consider. And I think, as has been highlighted, we know that if cups are introduced without the right questions and the right planning in place, then often it can actually cause damage to the reputation of cups in general, when in fact it's just down to the brand not being appropriate, or the trainer not being very well equipped, or the M&E not being followed up with in the correct way. So we're really just trying to help bringing different organizations together. We don't endorse one particular brand of cup. Instead, we're really focused on promoting choice and transparency. It's really vital, and as it's very clear, what is a kind of appropriate testing or the methodologies for introducing cups and producing cups is still slightly unclear, and as well as their categorization in different countries. But I think our real push is to try and be as transparent as much as possible about that, to ensure that researchers and individuals and organizations who are wanting to go forward with this can know that some of the things to think about and how other people are are introducing those factors. As I say, I feel that for us, we're really trying to be the go-between and to try and create an environment which will, in the really long term, not even really be needed, because cups should be so readily available and everyone should understand what to do and the places to go to. But until then, the barriers that exist because of stigma, misinformation and jargon, as well as the practical blockades such as lack of access to cups, lack of standards, import issues, and not having the right trainers to introduce them, those are all things that we're trying to work to overcome by bringing people together. And this year we had a very successful large virtual summit doing that, and that's something that in the long term we're really wanting to carry on with. So I'd really encourage people to go to the website, to get in touch, and in the end we want to have as many healthy and happy cup users as possible. So I'll stop there because I'm aware of time, and I think there's other people that have a lot as well to talk into. But if anyone has any queries about the Cup Coalition, do get in touch. Thank you. Sorry about the connection issues.
Great, Alethea. Thanks so much for that. That was really concise and clear and helpful.
Can I add?
Please.
This is Janie Hampton, also of the Menstrual Cup Coalition. I'd just like to add that the Cup Coalition has developed instructions which we've shared with many cup brands and projects that have been agreed by members that are safe, and we would like to take this further to give agreed guidance on the materials and the design, and that's something that we could maybe do next.
That's great, Janie. Is that something that could be shared perhaps through this group attending the webinar? Can we share those?
Absolutely, yes.
Excellent. That'd be great to see. Thank you. Awesome. I wish we had another couple of hours, but let's keep moving. Lisa, we have Lisa Hertz, who is going to be addressing several issues from the perspective of a manufacturer, not necessarily her own company, but obviously, you know, coming from their experience. But talking to us somewhat about ISO test standards and what are the tests that are important for cups to have passed in terms of not so much on the from what we've been hearing on the actual usage side, the consumer side and the field side, but the in developing and in manufacturing a product, what tests are most useful? What should people be looking for? And then what are the classifications to this issue that we're hearing about cups being medical devices or consumer products? And clearly there's not necessarily, we're not going to come to an answer today, but I think having the conversation about what that means. And then a little bit more about what should be on packaging and labeling. Thanks, Lisa. Go ahead.
Thank you, Nancy. Today's discussions have been so thorough and exciting, and bringing up, you know, just how complex this issue is. I can attest to that as a manufacturer, because having to take into consideration from everything, the materials that we use all the way through to, you know, how do you get users using these products successfully, which means, you know, working very closely with our partners in the field, like Chimera, and then looking at research, Penny's research in particular, to sort of, you know, keep pushing us along that, you know, these products are safe. So as a manufacturer, you know, looking back and seeing, you know, what other cup companies are doing, and I do want to represent most of the, you know, there's so many great quality menstrual cups out there. And then there are the inexpensive ones. And I just want to touch on that just for a moment in regard to design. And the only concern that I have in regard to design is that some of the cups come back and they're using very little silicone. I don't know what quality of silicone, but the cups are very thin and flimsy. So people, you know, the users are having difficulty getting these cups to open. Of course, they're leaking. And that is one of my most significant fears, is that the design is so flimsy that people are giving up on cups and thinking it just doesn't work for me. Because I think this product really is the way of the future, you know, away from single-use plastics, which that is menstrual pads. But in regard to the ISO, what ISO stands for, or, you know, the standards, there are different ISOs for different purposes. you have to think of them as a formula that's been distilled by experts, describing kind of the best way to do things. And there are many different standards that the ISO certification organization has developed, specifically for as a medical device. We always hear about ISO 13485. That is a quality management system that an organization, a manufacturer requires, that it demonstrates its ability to provide medical devices that consistently meet consumer and applicable regulatory requirements. And I work with a manufacturer that has ISO 13485 2016, and I feel secure with that, even though that is a medical device, and we're having the discussion medical device or consumer product. But when you do manufacture in a medical device facility, you know that your menstrual cup is being manufactured in a clean room. I do think that that's important when you're manufacturing menstrual cups, because you do want a clean environment. So that certainly gives some assurance that if there's the claim that your manufacturer has this certification, as well as me being a manufacturer, that having that certification indicates that it has met all the requirements for the clean room, and that they're packaged properly, and you be assured that there's very high standards within that facility. The other ISO family, the 10993, specifically in vitro, they do in vitro testing for biocompatibility. That's the cytotoxicity for medical devices. That is something that we have done, and as well as skin irritation and sensitization, because we've decided, as a manufacturer, that these were the most important of the 10993 biological testing that was important for us. But I did want to bring up in regard to what is a medical device, and it's interesting that in Australia it's considered a therapeutic device, which is the same thing. It's classified as the meaning of medical devices: any device intended for use for medical purposes. Medical devices benefit patients by helping care providers diagnose and treat patients, and help patients overcome sickness and disease, improving their quality of life. And I go back to this over and over again, because I don't understand why menstruation is sort of fits into this description, because it's not a sickness, it's certainly not a disease. So I think that but they do certainly improve quality of life. In Europe, as a consumer product, I can say in regard to the Be Free that we have at least 15,000 cups out in the market. We just went to market last year, and we have not had any callbacks with any health issues. I'm grateful for that, because as a manufacturer, and I think I can speak with most of the other sort of well-known manufacturers out there, that you can trust that there's accountability. Our main goal is to do no harm, and you certainly don't want to take risks of a young woman or young girl using a product that I don't understand why you would want something that isn't going to work in the first place, other than these cups that are going out at $1 a piece. That is sort of counter to what the menstrual cup is supposed to represent, as something that's a long-term use and to improve overall health and lifestyle. In regard to the better classification, we can discuss on that as well, but I did want to speak on medical grade silicones. There are a number of silicone cups out there that are not made with medical grade silicone. They are made with health grade silicone. But with medical grade silicones, it's just that they've gone through more testing. It also adds cost to those cups as well, because medical grade silicone is more expensive than even the healthcare silicone. There are strict requirements in the healthcare industry, and the products are made under the certified good manufacturing practice. So it's also in regard to when we do produce or we purchase the raw material, we also receive the master access files, and that is for us in particular, because those materials have gone through FDA approval. And Nancy, just to bring up in regard to FDA approval, you can get FDA approval for a menstrual cup, but it is in the US through FDA, but it is very expensive. Because they have seen so many menstrual cups, this is why you can just register. But at that point, you cannot claim that you're FDA approved unless you pay those, sort of really exorbitant fees. And I mean, even getting registration is quite expensive. So, and this speaks to like the expense of like what added costs there are in getting a cup to market. Of course, you want to use you want to put the cups through rigorous testing in ISO testings. But it should be minimum because the costs are really prohibitive. I mean, here in Canada, we do not have the benefit of just registering with Health Canada. We do have to go through approvals, and those approvals are in the tens of thousands of dollars even before you sell a product. So that kind of limits how many cups come on the market, how many different designs. I mean, I believe that there should be many cups on the market. So when you walk down that period of you have choice of menstrual cups as much as you have choice of menstrual pads or organic pads, or so that the choice in menstrual cups should also be very broad. It is up to us as for example, the Be-Free, we're setting out what makes the Be-Free a different cup, design and material. Next slide. I can look at my next slide. So, from the perspective of the manufacturer, as I said, like the quality and safety, for the most part, like all of us, the primary focus is to do no harm. I always recommend to use, reputable producers of silicone. There are some non-reputable producers of silicone, and, I have tested those and they have not behaved very well. So they prove to me that they are not, they're not the quality of the silicone that we as a manufacturer want to use. They might be more affordable, but flimsy and frustrating. And then it ends up the users are giving up on using a menstrual cup, which is much to their loss. And the minimum required standards that we abide by is, of course, we manufacture with an ISO 13485 certified facility. We manufacture here in Canada, actually, so that I can go and be a part of that kind of oversight. Medical grade silicone we use, that is up to the qualifications or testing up to a class 6 medical device with FDA documentation and master access files. The higher the quality of the silicone, of course, the higher the cost to produce the cups, but we still are able to produce cups low enough to make them affordable in low and middle income countries. As a social enterprise, this is our goal and our focus. We work, with Shamira. Uganda is primarily the country that we have been working in, as well as Kenya and now in Colombia. And we also very much want evidence, M&E. I refer to Penny's studies quite often. We do our own studies as well. They are in lab, they are in vitro, and we would like to see, the discussion expand with more in vivo testing. And that being that, a cup that's used for 6 months or one that's used for a year can go in and be tested for, with a microbiologist to determine, what is the status, or are there any changes in the material over time, to determine what kind of biofilm is forming, design parameters, the benefits, teaching and training, so that you do have the successful uptake of the users, and you do have to be there. Most of my day is spent communicating with our customers, and they can contact us through our 1-800 line. They can contact us through email, through Facebook, and I think that's really vital. We are just setting up a toll-free telephone line in Uganda, so that users will, or even non-users, those that are interested in using the cup, have access to support and the education. I commend Wamena for, even teaching me so much in regard to going in and doing follow-up with the users. It is so important, the education side of things, and as well choice. And that is something that we absolutely support and work towards, while always looking at the standards of all of the products.
This is fantastic information. I'm wondering whether you could also make maybe one more point. I don't know if you have another slide, so we can get on to Saloy, and then we have many questions coming in for all of you. So just pick one of your slides that you feel is the most important to represent in the last minute, and then we will move on to Saloy. Thank you.
Thank you. I did want to speak on evidence-based in regard to more proof that boiling the cup between 5 and 8 minutes, or it's good for the user to have proof of that. And let's go to the last slide. And the last slide is regarding labeling requirements. It is so vital for the labeling requirements that, we use a tin actually, and that was very much in response to rats getting access to the cups, so that they have a good storage device, as well as if they want to carry water into it or boil water into it. But in regard to the labeling requirements, absolutely the name on the device, the name and address of the manufacturer, the identifier of the device, and making it, unless self-evident, the intended user, the medical conditions, purposes, and use, and the device is manufactured, sold, and represented. The directions for use are really vital. We have a bag on the inside that has pictographs that show it because there's so many languages that we're dealing with, that it's by pictograph and very simple graphics on how to first wash your hands, the insertion, the removal, but the removal to absolutely break the seal, so that you don't have the worry in regard to dislodging an IUD. We put in the contraindications for use, that if there's an underlying infection, or if you have any irritability, sensitivity to not use, go to the doctor, and then any warnings and cautions that the person might be aware of, and then of course the description of where to store the device safely. Thank you, Nancy.
Thanks so much, Lisa. This is a wealth of information. I wish we had more time, but we want to include Saloy. Yeah, and then also have lots and lots of questions. So Saloy, please go ahead and take a few minutes to describe the important work that UNFPA is doing in this area.
Thank you very much. I don't have slides to share with you, but really this is a very nice segue after the previous presentation about the price of the material, which impacts the price of the product. It's very important for us to always remember that sometimes quality does come at a cost, especially for products such as these ones, that you do not want any toxic material to be entering the young ladies and the women's bodies. So it's very important that the manufacturers adhere to the standards that will be do no harm to the users. So UNFPA started work, I think it's about 2 years ago. Really the discussion started more than 4 years ago. We really need to start working on specifications for menstrual cups. And, we had not really picked up the momentum until we got support from one of our colleagues who just left about a month ago, Mina Soikeli, who was a junior professional officer supported by the Finnish government, who was working with us for 3 years. She worked on this project along with other UNICEF colleagues. So what we decided to do was, okay, we wanted to know what is out there in the market first before we start coming up with our own, sort of cooked up internally specifications as the UN family. But we really thought it's important to understand what the manufacturers are doing and what standards and are they complying with, and then try to understand that, and based on that then develop a UN-wide specifications for menstrual cup, and hence we partnered with UNICEF on this one. We received responses from 31 suppliers, which is a very good response. And in that response, it was very clear that there is some commonalities in terms of the approaches. The basic information such as labeling, they all made sure they had labeling. What was different was the extent of the information that was being provided in that. We also got to know the materials that they are using out there. And it was actually quite challenging for us to realize that just over half of the suppliers are able to use their medical grade silicone. So that means we need to do a lot of work in terms of advocacy for the right level of grade of the silicone. Some of the products also included some dyes that may actually lead to leaching. I think one presentation from Uganda talked about leaching. I can't remember who presented, but we assessed these issues from the different suppliers. We also looked into whether they did look into any ISO standards that are available out there and they tried to comply with them. Some of them did look into that, but a good number of them did not actually consider the ISO standards as part of their development. We looked also into the different sizes that these suppliers were providing. In general, the sizes are almost the same in terms of the standard sizes that we expect. And we also assessed the withdrawal mechanism. What type of withdrawal mechanism was there, and how, you know, these different types that they had, did they even assess them for user acceptability? We looked into the issue of regulations. It's been part of the discussion here. What regulations, what standards should these products be adhering to? It varies from country to country. And we believe as a UN family, we are able to convene all their partners globally, and we can help come up with some sort of generic specifications that may be acceptable to most partners. About just over half of them looked to ISO 13485, which is the medical devices, and less than half were working on, or were considering the FDA approval or the CE self-declaration. The one thing that is good is that majority of them considered that it is important that they comply with the ISO 10993 Part 5 standard, particularly the one that talks to cytotoxicity assessment for medical devices. They also talked about Part 10 of the ISO 10993, which talks to testing for irritation and skin sensitization. And you can see that these manufacturers have put thought into their processes, into the products, and all we need to do is to work with them to find a way of standardizing the specifications. What are we going to do? What did we do with the survey results? The survey results now were used to establish generic specifications, which we are still at the final stages now of editorial stages before we can share publicly. What I can say comfortably is that majority of what the presenters have raised in the press presentations of today have been captured in the specifications, and we will be sharing them with the community. Thank you.
That's fantastic, Saloy. What a great way to end the presentations from the panelists, to know that there are these generic specifications that will be shared broadly and may offer a place for us to coalesce around in terms of having standards that address what are the key issues. So we will eagerly await the sharing of those. And in the meantime, I want to take the last 12 minutes or so to go through some of the many questions. And I'd just like to say that we'll do our very best to get back to everyone who asked questions after this, because we won't get through them all. So the first one was from Sumati Joshi, who wanted to know about follow up, and this is Penny, I think more for you, follow up on the research studies that you presented that wasn't beyond 12 months. And I think you would probably agree, as you said, there are many things that can be studied, and I think probably funding is a key issue in this. But the point was that since menstrual cups are positioned as long-term sustainable use products, can we extrapolate the data, or would further studies over longer time give more clarity? So if you could speak to that, Penny, that would be great.
Yeah, I just found the unmute button just in time. Yes, absolutely. Can you hear me? Yes? Hello?
Yes, we hear you.
Yes, okay. So yes, indeed, the first pilot study we were involved with was indeed a mean of follow-up for 10 months, 10.9 months. So we're now following up secondary school girls over, well, up to 3 years. So that is indeed a longer time duration, particularly if you think that people do take a while to get used to cups. So those first few months of use are really not very representative of their actual use. So long-term monitoring, combined monitoring between different programs, different populations, different age groups. I think it would be absolutely, it's fundamentally important. It should be like post-marketing surveillance of drugs and everything else. I mean, we do need long-term, how long is the real shelf life? I mean, Janie's mentioned, is it 10 years? At 10 years, do you stop it? Would the cup last 20 years? If it's cracked and then it continues to be worn, are there issues related to that? So yeah, thank you for bringing that up.
Great, thanks, Penny. So there's a question, Shamira, for you about if NGOs distribute cups and product companies are responsible for labeling guidelines during on-the-ground implementation, whose responsibility is it to ensure last mile awareness and support on the products? So basically, who's responsible for ensuring that the woman or the menstruator at the last mile is aware of what's happening, of what's required in terms of safe use of that product?
So both, I think, the manufacturer and the NGOs, because it affects both of us. I would say if the manufacturer provides wrong information and I get wrong information as the implementer, then I'll provide that wrong information to the end user, so they'll end up using the product poorly. So whoever gives me the menstrual cup to deliver on ground should tell me the specifications of those products and tell me how it should be used. I would say, for example, the Be-Free, it is different from other products. It's not supposed to be oiled and what have you. So when the manufacturer comes to me, they should tell me what exactly as the implementer is entailed in their product and how I should deliver this using my experience as the implementer. Yes.
Great, thanks, Shamira. I think that points to, though, the fact that if different cups are different, then that user information that's available and the involvement with somebody who can be sure that the end user knows how to handle that cup is so important. Also, there's a question from Janie Hampton about which cups Womena uses, and does the Uganda government allow particular cup brands into the country or just cups in general? And I think we want to just answer this quickly, but I wonder if other people could answer also for their countries about whether only particular brands are allowed in, or are menstrual cups allowed in general. Thanks, Shamira.
Maybe I could actually answer on that. I already wrote
Sure.
it in the chat. This is Siri speaking, because
Yes.
we actually have the list. So I mean, we have actually been importing, sorry Shamira, I hope this is okay by you. We have been importing quite a lot of different brands, Ruby cups, organic cups, clean cups, Be-Free, Flow cup, various kinds, because we make a big point out of being brand neutral. I mean, as long as they live up to the standards that we are trying to use, for example, being medical grade silicone. And the government does not yet have standards. That's exactly what we're trying to help. So they do not have a general clearance at all. They clear each batch, and they do it, and this is the UNBS, and they have fairly complex or strict standards. They have pre-shipment and post-arrival. They check, they clear them, and then they cleared that particular batch, which is to our mind both a little bit cumbersome, and it's also probably not the best insurance that is living up to standards, because some customs officers will ask different kinds of questions, like many of them will ask, are these FDA approved? And this comes down to all the language that we were talking about before. So I mean, that's why I think standards are standards. It's good if you have. So that's what we're trying to work on. And I mean, Samir knows more about how we're working on it. I just thought I'd give this overall thing on what it is. Please, Shamir.
Thank
also.
you, Siri. That's very helpful. We appreciate that response. And I think that it does point to some of these the challenges around the jargon and the language, and how important it is to have a set of standards that defines terms, so that everyone knows what a quality cup or cup that has passed certain benchmarks would need to have.
And what do we mean by approval, for example? Yeah.
Yeah. There's a question from Mags Beksinska in South Africa saying, in the long term, should a standalone standard be developed similar to those that are available for condoms, diaphragms, which fall under mechanical contraceptives? So I think anyone can speak to this. Anybody who would like to. I don't know if you want to speak to it, Saloy, or anyone who has a thought about that. Should a standalone standard be developed similar to those that are available for condoms and diaphragms, which are considered mechanical contraceptives? Obviously, a cup is in a different category because it's not, it doesn't perform the same sort of a function. But what do others think about that?
Hi, this is Saloy. Indeed, Max, we need to have one place where we can find these specifications, which are agreed by many partners and can be used. They are unlikely to be similar, even in terms of structure, to the medical devices, because they are not entirely medical devices. So I believe when you see the draft from UNFPA and UNICEF, you will see that it can actually be used globally across even manufacturers. Thank you.
Thanks so much, Saloy. That's helpful. And again, knowing that the UNFPA and UNICEF have these standards that are coming up, specifications, we will be able to, I'm sure these will be available through many of us that are on this call through our various coalitions, and that UNICEF and UNFPA will share these widely. There's a question from Priyanka Jain on, based on my personal experience and comments on my YouTube, Facebook group of menstrual cup users, I've noticed that softer cups tend to leak more as compared to harder cups. So just a question about leaking and materials perhaps used in cups. Does anyone want to address that one?
It's Lisa here. I can certainly address that one. And yes, working with mechanical engineers to make sure that the cup, it can be soft in the body, but it does need that kind of springing open action at the top. So do they leak more? Again, it depends on the design. So you do want a cup that, because the vaginal muscles can be quite strong, and they can push against the cup so that it doesn't open properly. So there are many cups out there that have a soft body, but again, it's that ring around the top that helps to get the cup to pop open. Or if you're inserting and you spin, that it helps it to open up. But generally, some of the inexpensive cups that are coming in are soft throughout the cup, including the ring. And those, I just feel terrible for people that try them and just get so frustrated they never want to try a menstrual cup again. And that's very much a disservice to them. And yeah, I hope that answers your question.
Thanks, Lisa. That's helpful. I think it is that disservice. I think that's one of the challenges with introducing, even though this is not a new product, we know that menstrual cups were patented in 1937, I believe it was originally, so not new, but new to a global use and how important it is to have the quality so that people know when they're buying something, they know what they're getting. Lisa, just again, we only have a minute or so left. But if you could very quickly say the ISO standard 10993 for biocompatibility should be done for raw materials, silicone, or for the final product, and should there be any other tests for safety of the final product? Actually, you or Saloy could maybe quickly answer this one.
From our experience, I can quickly indicate that we do have the master files for the raw materials. They have been through some testing, but we do the ISO 10993, the cytotoxicity at number 5 and 10, do those post-production, so that the product that before it goes to the user, that it has gone through, not every single one, but different from different production runs that they go through to make sure that it's after production, before use, that those tests are done.
Great, thank you, Lisa. Last question in our last 30 seconds. Alethea, for you. There's a question asking, how does one join the Menstrual Cup Coalition? I think that's a good way to end this, as I'm sure many people are interested to be part of that. Can you tell us how people would join?
Yeah, hi. If you go on the website, which I think has been posted in the chat box a couple of times, and there's a contact form on there, and it'd be great. As the more people that join it, the more helpful it is as a way of connecting people together. And as I say, really, it's just trying to be a forum to make sure that people are sharing, because as is clear from today, so many people are doing so many interesting things. And I would say that compared to 5+ years ago, there is so much evidence building. And the best thing is that we don't keep trying to reinvent the wheel, and that cup practices do learn and improve from one to the other. So it's great to be connecting more and more going forward. And thank you for this as a way of doing that as well.
Just to say, to join the Cup Coalition, it's for organisations, not individuals. So if you're an individual working in cups, it needs to be part of a manufacturer or a project or anything to do with menstrual cups.
Thanks, Janie and Alethea. That's great. Thank you, everyone, for joining. I wish we had more time, because there are many more questions, which, as I said, we'll try to get to in responding to the individuals who asked them at least. And perhaps we can send out something to the participants as well. Thank you for this rich conversation, and for all of your work and interest in menstrual cups. And it's exciting that we see some many positive signs, but the fact that there will be some shared specifications soon, and all the great work that's being done by these various people, and many, many more that are not represented here. Thank you so much, and good day, good evening.
Thank you.